This lecture is on dental implants. The learning objectives you can find in your Kindle or your Red Shelf. Dental implants are artificial teeth that are anchored to surgically embedded tissue or bone. Incorporate principles from both fixed and removable prosthodontics in conjunction with the use of bone anchored implants. This is the process of how a dental implant goes. So A is the initial placement. So they put the implant into the bone. In B, they insert the fixture. So there's a cover screw that they put on, and then they put the tissue over it. Now, the healing time can range anywhere from 3 to 6 months. They say the mandibular heals quicker than the maxillary. So mandibular could be 3, maxillary 6. And then after the healing is done, they come back for the insertion of the abutment, which is this piece up here. It gets inserted. We wait for healing time on that, and then we make the crown and we place the crown above it. So there's different healing times for the different stages, and also there's different types of implants that we're going to talk about. Now, indications for implants: you replace one or more teeth as single units. It can support a bridge and eliminate the need for a partial denture. Provide support for a denture, making it more comfortable. Prevent bone loss and gum recession. Enhance patient confidence in smiling or speaking. Improve overall psychological health. Improve aesthetic appearance of the teeth and mouth. Most patients find that when they have a full lower denture, it could be a mouthful. So implants are a good option, even for those that don't, that cannot wear dentures. That might be an option for them too. The implants do have a 90% success rate, and of course, it requires heavy commitment on the patient's part. And contraindications to dental implants: well, the financial investment is greater. Treatment can take several months to complete. An implant may loosen and require replacement. Implant procedures may be emotionally challenging for some patients. Bruxism is a significant component of failed implants, so those that are constantly grinding their teeth, this might not be their option, and if they can't afford it, they also have to come back and visit us so we can always check the parts, make sure everything is nice and tight and that the implant is doing its job. The dental implant patient psychological evaluation: the dentist assesses the patient's attitude, ability to cooperate during complex procedures, and overall outlook on dental treatment. The dental examination: the dentist evaluates the condition of the teeth, soft tissues, areas of attached and unattached tissue, and the height and the width of the edentulous alveolar bone ridge. We will also take medical history and evaluation. The dentist assesses any existing medical condition that could worsen as a result of the stress of implant surgery. We take x-rays, radiographs, and imaging, whether it's periapical, panoramic, cephalometric radiographs, as well as tomograms are needed to evaluate the height, width, and quality of bone. Diagnostic cast and surgical stent can be made. A surgical stent is made. Cast can be taken by the assistant. Preparation for implants: we need informed consent. The consent form should advise and educate the patient about background information on implants, complications of implant surgery, prognosis, time frame, home care, and follow-up appointments. Surgical preparation for implants: implant surgery must be completed under strict surgical sterile conditions with sterile instrumentation. The head is draped and a sterile surgical drape is applied to the circumferal area, leaving only the mouth exposed. It is recommended that the implant team consists of at least 3 people: the clinician, the surgical dental assistant, and the non-sterile circulating assistant. Usually, before we start, we rinse the mouth with chlorhexidine. Okay, so that's a prescribed mouthwash, and we have that in the office. And also, we make sure that the implant it's in its package, and before placement, the inner valve is open and the implant is allowed to slide untouched onto a sterile surface, so we don't want to touch it until we're ready to use it. Types of dental implants, there's endosteel implant. That one is the most common. Maxillary implant, floor or maxillary sinus is close to roots of maxillary, molar, and premolar teeth. Subperiosteal implant is placed under the periosteum and on top of bone. And transosteal implant, it's inserted through the inferior border of the mandible. So what type, again, that is most commonly is the endosteel, but these other ones that I mentioned, the doctor is the one that knows the best one to use. He will let you know. Again, all patients differ, and it depends on their bone. Endosteel implants, also known as Acio Integrated implants. These implants are surgically placed in the bone. Implants and abutment screws are commonly made from titanium because of its compatibility with bone and oral tissues. Titanium implants can be coated with hydroxyapatite. Endosteel implants have three components. They have the titanium implant, the titanium abutment screw, and the abutment post or cylinder. Acio means bone, and continuation, Acio integration. In this process, the living jawbone naturally grows around the implanted dental supports. It refers to the bond that is developed between living bone and the surface of the implant fixture. And again, it could take anywhere between 3 and 6 months for this process. Procedure process of an endosteel implant. First, we do the surgery. The implant fixture is placed in receptor sites in the jawbone at predetermined locations. The mucosal structure is sutured over the fixtures, and again, a period of 3 to 6 months is required to permit the fixture to osseointegrate or bond to the bone. Now, at this point, the patient has to be extremely careful during this stage, not to cause any trauma to that area, to the mucosa. Strict sterile conditions are enforced during this procedure because we have to make sure when we're going into the bone, everything is nice and clean. And we use sterile saline solution to irrigate the surgical site. Then the second surgery, the implant fixture is exposed and the abutment screw is connected to the anchor. The implant protrudes through the mucosa and connects the fixture to the prosthesis. The patient begins the restorative phase. Maxillary implants. Maxillary sinus is consideration when placing dental implants in maxillary jaw. Sinus lift or bone graft to floor of maxillary sinus may be indicated. Subperiosteal implant. With this type of implant, a metal frame is placed under the periosteum but on top of the bone. It's usually indicated for patients who do not have sufficient alveolar ridge remaining to support the endosteel type implant. 2 surgical procedures are required for this type of implant. And it may look like this. So this is a denture that goes over this. They lifted up the denture so you can see it a little bit better. These are the implants on the bottom, these metal parts over here, and then the dental implants connect to the denture connects to the dental implants. Procedure process of a subperiosteal implant. First surgery, the alveolar ridge is exposed and impressions are taken. The tissue is repositioned over the ridge and sutured back into place. The impression is sent to the laboratory where a metal frame with posts is fabricated. The second surgery, the alveolar ridge is surgically exposed. The metal frame is placed over the ridge. With the frame in place, the tissues are repositioned and sutured into place. And again, 3 to 6 months of healing time. Everybody's different. It depends on the patient. Transosteal implant. These implants are primarily used in patients with severely resorbed ridges. The implant is inserted through the inferior border of the mandible and into the edentulous area. Edentulous means no teeth. Now, maintenance of dental implants, home care devices is toothbrushes, manual or electric, single tuft toothbrushes, partial denture clasp brushes, interproximal brushes, dental implant floss, and regular floss. And of course, the success of implants depends on good home care. So we really need to discuss that with the patient. We give them complete instruction on home care devices, what's good, what they can use, why is it so important. And then again, as I mentioned before, patients should keep up with their regular recall visits so we can make sure that everything is well. And then once they come in for their routine office visits, we'll take x-rays, take a look and make sure that everything's fine. We'll do the examination, the prophylaxis. We want to make sure everything's nice and clean. Removable of fixed components, replacement of components, and relines and remakes are recommended. So there is other processes that they may need, even if they have an implant. We still have to check them. Like I mentioned to you, they're like screws. You know how things, when you use something, a screw can become loose. We do cement implants also along with the screws, but the cement wash can loosen up over time. So again, it's a big investment. They should really make um, the sound decision to come for their routine office visits. And again, we had this lecture already. This is for the people that were not here. So if you have any questions, please reach out to me via text, telegram, or email.